How does muscle biopsy compare to genetic testing for muscular dystrophy? When it comes to diagnosing muscular dystrophy, muscle biopsy and genetic testing are two important tools, but they work in different ways. Muscle biopsy involves taking a small piece of muscle tissue from the body. This sample is examined under a microscope to look for signs of muscle damage, inflammation, and other abnormalities. It helps doctors see the structure of the muscle fibers and identify patterns that may indicate specific types of muscular dystrophy. For example, it can reveal if there are issues with proteins like dystrophin, which is important in conditions like Duchenne and Becker muscular dystrophies. However, muscle biopsy is an invasive procedure and may not always determine the exact genetic cause of the disease. On the other hand, genetic testing analyzes a sample of blood or saliva to find mutations in genes that are known to cause muscular dystrophy. This method is less invasive and can provide a clear diagnosis by identifying the specific genetic mutation involved. Genetic testing is particularly useful for confirming a diagnosis, helping with prognosis, and assisting in family planning by detecting carriers of the condition. It can even identify mutations before any symptoms appear, which allows for earlier intervention. However, sometimes genetic testing may uncover variants that are not clearly understood or might miss mutations in rarer genes. In clinical practice, genetic testing has become the first choice for diagnosing muscular dystrophy because it is less invasive and more definitive in finding the underlying cause. Muscle biopsy is typically used when genetic testing results are unclear or when more information about muscle pathology is needed to inform treatment decisions. Both methods can complement each other effectively. The biopsy provides valuable information about muscle function and structure, while genetic testing offers a molecular diagnosis. Overall, genetic testing is now seen as the standard initial diagnostic approach for muscular dystrophy. Muscle biopsy plays a supportive role, especially in complex cases or research. Using both methods together can help ensure accurate diagnosis and better care planning for patients. Always consult with healthcare professionals for personalized advice and information regarding these diagnostic tools.